Welcome, dear friends, viewers, colleagues, and of course, my dear medical students. Welcome to MuniMeterHealth, your source of learning cardiology and human heart illnesses and awareness. So welcome again. This is Dr. Jaitly, your cardiologist from New York. Today, you must be wondering, what am I showing you on the screen here? Well, essentially, I got a suggestion and somebody wrote to me. In fact, quite a few people have expressed that. How do we best utilize your website? So I said, well, let me do a couple of videos for you guys and show you exactly how you can utilize for your best, quick, efficient way to work through my model here. So we have, this is like more of a demonstration here, for instance. Now, you open up your site based on whether you're on YouTube or whatever. Yeah, of course, this is a screen from out of YouTube. So MuniMeterHealth is your site, and then once you open that, you can go, this is your home page that will open. You can look at the videos if you like and pick up the video that you want to see in this fashion. Whether would you like to understand about myocarditis, whether you'd like to see hear about the stem cells, you want to know about the thrombolytic therapy and how does nitroglycerin work, and can cell treatment change future of cardiology, or cell transplants, or various other things, like a simple basic anatomical question: what is conduction system, or what is an introduction to the coronary stents, for instance, or what is a pacemaker, for instance. So this may be very good for a fellow or somebody like a 30-year resident who'd like to know what is a pacemaker, how it's working, especially somebody preparing for exams and boards and national or American boards, etc. So once you do that, then you can open up any of these videos and it starts playing. So that's one way to look at. The other way to look at is you can also sort them out by what are the most popular videos being watched, for instance. And here you could see what is hibernating and stunned myocardium. Now this would be very good for somebody who's rotating through nuclear cardiology. Maybe a cardiology fellow would be interested in knowing about constrictive pericarditis versus restrictive cardiomyopathy. A colleague like mine would be interested in, if he or she is planning to see a patient the next day in the ICU or CCU settings. Similarly, again, we have English and Hindi videos all over the place, but the fact is that you can screen them very easily. So what you do is, if you were to type MuniMeterHealth, there you go, and give a space like that, and say if you wanted to know about chest pain. Now chest pain shows up like this. So all of the videos that are actually pertaining to chest pain will line up here for you for your ease. Like, what are the other causes of chest pain? What are medically urgent causes of chest pain, for instance? What is pericarditis, which is also a chest, a reason for chest pain? Then say if you're dealing with aortic stenosis, how do you calculate an aortic valve area? Now that will give you chest pain or angina, in that setting. And similarly, anything that's connected to chest pain will line up here. Like a case you wanted to know about pulmonary embolism and how do you diagnose it? Would that be a cause of chest pain? So what we have done is we have tagged every single word in cardiology, again, as much as possible under the possibilities and feasibilities within us. But the fact is that at least anything under the sun that you can think of, you would have in cardiology would be all within this. So space, for instance. Now, if you say dyspnea, now say if a resident or student wants to know about dyspnea, so MuniMeterHealth, type that in, give a space, and then type dyspnea, right? Just like you did here. So when you did that, all of these would line up. Say now you know exactly how dyspnea works, so you can actually look at how to grade dyspnea and angina, for instance, in this case, when to suspect pulmonary embolism, and that could be connected to dyspnea. What are heart valve implants, and when are they prescribed, or when are they actually placed in? What is SVC syndrome? SVC syndrome also leads to dyspnea, as you know. So these are some of your classic examples how you can quickly work through my website and actually understand the illnesses, explore the symptoms, explore the conditions, maybe the therapy. Now, if you wanted to know, say, something about like valves and say treatment, so you can plug in some relevant keywords and you will perhaps see some of these that line up. So you could do that, or just do valves, for instance, and you could see all these all these lining up, and then you could see that these are MuniMeter valves, for instance, could be seen. Like you could see introduction to human heart valves. Then you could see valve regurgitation and stenosis here. And the list goes on. You can keep reviewing these up and down and continue to see. Bernoulli equation, for instance, somebody who's studying for an echo. How do you calculate aortic stenosis? Somebody who's studying for nuclear boards, hibernating and stunned myocardium. What to look for an echo in aortic stenosis. Now, these are various things that you really need to ascertain before you complete an aortic stenosis interrogation in a patient. So, there's a whole bunch of things that you can actually see, explore quickly, and that's why I chose to do this for you guys, so that we have an idea as to what we can actually see in terms of our best way of utilizing this website for you. So again, I thank you for your attention, obviously, and I certainly want to make sure that you understand, so this way you can actually go over all your videos in that. Now, one other thing, we have playlists. We have also included some of these common conditions like in a form of playlist, and we're growing. Again, we are growing in our playlist as well. So for ease, for instance, somebody wants to know all about heart and cholesterol. So what we have done is, we have made a playlist for you, so you can look up some playlists here. So like 12 videos are on heart and cholesterol, heart and CAD, 26 videos. So they'll all line up, and you can finish all of them like in half a day or something if you like, or spread them around over several days. You can just finish them up by looking at or watching them a couple of videos each day. Likewise, you have a full course of heart and diabetes here. It's a full entree here, 13 videos. Then you have heart and atrial fibrillation, about 16 videos. And you have heart and nutrition, and the list goes on. So you can move around these playlists and start looking at some of these again. You can see heart and nutrition, heart valves, and what have you. So there's a whole bunch of these patients who have these playlists that can be of some use to you rather quickly and very efficiently, because the whole idea is wanting to see how quickly you can get your answers through our website, which is very user friendly. We're trying to make it more and more friendlier for you and more efficient for you. So as we move forward, our newer technologies are going to be incorporated, as you see. So stay tuned and stay on MuniMeterHealth and stay healthy. Stay always top on your education and top on your knowledge about the heart and cardiology, and that's precisely why we have MuniMeterHealth for you, freely to all over the world. So again, I thank you for your suggestions and for your questions. Please write back, and of course, if you did like this little demonstration that we created for you, also do not forget to press the like button. This is Dr. Jaitly again from New York, and so long.